All, this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. I hope you had a great weekend. As promised, we're going to start talking about the long haulers. So I have been doing a lot of research about this situation, and there is a lots of data to be discussed. So what I thought was the following plan. Number one, today we will set up two main things. Number one, let's look at the signs and symptoms that are experienced. There are more than 200, but we'll see the most common ones. And secondly, let's look at the management that is so far evolving. And let's look at the rationale or the reasons for that management. After this, as we progress through the week and we look at reasons and more data, we will then modify our management according to the new data that we find. So that means what I'm presenting today is something that can be changing in the coming days. But I wanted to make sure that anybody who is watching it, at least they have an idea of how their doctor may be able to start helping them. So let's start our discussion. I'm going to share my screen. So here is drbeen.com. This is there are many links here that I have in the description as well. This is UC Davis, University of California, Davis. And this is their list of the most common symptoms that they have observed. So coughing, ongoing, something debilitating, fatigue, body aches, joint pains, shortness of breath, loss of taste and smell, headache, difficulty sleeping, brain fog. Then here is a very interesting site. They have been collecting the studies that are going on for long haulers that have completed, or the articles that have completed, and then the studies that are still going on. So I think it is an interesting tracker to keep an eye on. So I have this link in the description as well. Here we have Dr. Bruce Patterson's paper. He has created an index or a ranking system to see who could be a long hauler and what is their severity of long haul. So we'll look into that at a later stage as well. This is an article, Immunologic Modeling of COVID-19 Severity and Chronicity. This article is based on Dr. Patterson's article. This is NIH and their director's blog. I have certain data to be used from here. That is why I have it here. Then this is another registry of people who are long hauling. And then so in this registry, they're sharing with the folks the newer discoveries and possible solutions. This is another data set. This is about the long haulers and the most common symptoms. If you see the symptoms that I read from UC Davis and the symptoms here are very different. So this was a survey done online. Online survey does have a bias, and that is only those people can participate who can go online. And so that may have that bias, but still fatigue, post-exertional malaise, cognitive dysfunction or brain fog, these are the most common that they found. Then this is another study. This is a great article where they have talked about various reasons, possible reasons. And then this is Harvard. Harvard thinks that the reason for the long hauling is low-level inflammation or decreased blood flow through the brain or autoimmune conditions that are attacking the brain tissue. Very interesting. This is a very different take on long hauling compared to others. This is a study which is still ongoing, in which they are using Leronlimab in the long hauling patients to see if there is an outcome. This study is still going on. This is another article for the long hauling symptoms. This is CCR5, and I'll discuss CCR5 today. And finally, here is a drug which is a CCR5 blocker, and I'll discuss that too. So with this, let's start our discussion. So again, the takeaway from today's discussion are going to be two. Number one, what are the common symptoms? And number two, what are the possible solutions? Now, my request to you, this is something that we will all do together. So please tell me, what symptoms have you experienced? Because from a symptom point of view, these articles are all over the place. Somebody comes in and says, fatigue is the most common one. And another person comes in and says, shortness of breath is the most common. Somebody else comes in and says, persistent cough and fevers is more common. So please tell me, what is it that you have been feeling? So let's start. So common symptoms. Here is an important concept to keep in mind. And here is the study that I'm referencing. This study has looked at 3,762 participants, again, online study, who responded from 56 countries about the persistent symptoms after COVID-19. And important thing, please note here, 78.9% were women. This is, of course, a sad thing. At the same time, this is an important clue to keep in mind, and that is women usually have more immune system issues compared to men. And that is because of the complexity of their system, the hormones, then their pregnancy, and the readiness for creating another life. So because of that, their system is different and their immune system is different. Usually autoimmune diseases are more common in women than men. And here, if you see 78.9, almost 79% participants who were in long hauling were women as well. Now, why is that important? If it was just the virus that was causing damage, let's say damage to the brain tissue, then the symptoms will be equally present in both sexes. If it was the virus just damaging the respiratory tissue and that was causing long hauling, then the symptoms will be present equally in both sexes. But a disproportionate number of women have these symptoms compared to men means that this is something to do with the immune system as well. So it may be the viral persistence, it may be the immune system's dysregulation, it may be immune system's mimicry or tissue mimicry, which we'll discuss today, but it has to be something to do with the immune system itself as well. So that is why this is important, not just because women are suffering more. Of course, that is a sad thing that it is more in women, but it is an important clue as well. All right, so in this study, most common symptoms: fatigue, post-exertional malaise, meaning feeling of being down and drained and unhappy and tired after doing something. I have heard patients who said, if I just walk a little bit, I feel fatigued and I feel down. I have seen people who say that if I just work for 20-30 minutes, then that becomes a lot of work for me and I become very exhausted. So post-exertional malaise, brain fog. And brain fog, not only a state of confusion and a state of depression and anxiety and fear, but also cognitive problems. That is, not being able to remember things correctly, not being able to recall things properly, issues with the sentences, words, recognition of things. All of those issues are also observed. Because of this, many scientists have been saying that, well, this probably means that it is brain tissue getting damaged. And then there are others who are saying that this probably means the immune system is actually causing inflammation, and that is causing the issues. So we'll look into those things as well. Another bigger group of issues that we are seeing are respiratory system issues, where there could be shortness of breath. Small exertion causes shortness of breath. I have now been in contact with the patients who are long hauling, and they say they're healthy patients, 20 years, 30 years old, who now are back from hospital and they still need oxygen to be able to sleep correctly or sleep at all. Sleeplessness is another issue as well. Body aches, cough, chills, sweat, headaches, GIT issues, sleep issues are very common as well. And these issues are, this is another important thing. It is not necessary that these issues are only occurring in severe patients. Many times, just the mild cases, patients who are just generally okay, they never even ended up in a hospital, but they ended up in a long haul state. This also tells us that it is very important for the prophylaxis and for the correct management during the early phase as well, during which, at least in the US, unfortunately, we just tell people to stay at home. That is a very important time. That is a critical time when the patient has to be managed so they do not end up in a long haul state. So with these, let's look at some of the possible solutions, approach to management. And so once again, my disclaimer here, this is not a prescription for anyone here, number one. Number two, this is what I have been doing with my patients, and I have seen others doing with their patients, and I have collected them together for various phases of the disease. And as we continue our discussions and look deeper in the data, we will add or remove the substances or medicines from here. So let's start. Look, the current approach to management, and I have only written manage, so management. So the current approach to management, number one is prevention, and number two is managing once it has happened. So in case of prevention, you know it that I've been saying this from the very first day, prophylaxis is very important. And of course, the most important thing there is ivermectin. And I have talked about the mechanism of actions of ivermectin. It would become very lengthy if I added all mechanisms here. So let's just agree that this is something that we know how it works. And if you do not, there are many, many videos I've done about the mechanism of action. Ivermectin in prophylaxis is very important. Not only it reduces the virus replication, it also reduces the inflammation, so the chances of becoming a long hauler are reduced. Vitamin D must be in a balanced state. And vitamin D needs to be packaged with vitamin K2 and calcium, magnesium, selenium, copper, like things. So this whole package, again, with your doctor's permission. Although it is weird that today my wife went to a doctor and she came back and she told me that doctor said, "What are you taking?" And she said, "I'm taking vitamin D and other supplements." And she said he shrugged his shoulders and said, "Well, if it makes you psychologically happy, then sure, do it. Otherwise, these things have no benefit." And I cannot imagine that doctors saying such things. Vitamin C, melatonin, CoQ10. CoQ10 especially important for the electron chain, and I've done a discussion about this. NSE or glutathione. My preference is NSE, but some people do not like NSE because of its smell, so then glutathione. Curcumin, black seed oil, honey, and aspirin. And the ones that I've made red means that these need to be specially taken with care because there are consequences of taking them. Aspirin continuous use can cause blood thinning, so one has to ask the doctor. Acute phase, if the disease has occurred, then ivermectin, of course. Ivermectin is in all phases. Vitamin D, of course, plus its additives here. Then here is something that is important, and I never knew that I was doing this and that was helping prevent my patients from becoming long haulers. And that was that I would always add steroids a little later during the therapy. And I think what is that doing is that is keeping the immune system from becoming dysregulated. So, but I do not use steroids in the beginning. There are many doctors who use it in the beginning. I do not. But course of steroids during the illness, later in illness is very, very important to keep the inflammatory and immune dysregulations in check. Then fluvoxamine. Again, I have it in red because the side effects can be up to suiciding. So because fluvoxamine has these kind of side effects, it is necessary to take it only with doctor's advice and with the correct dosage and with the correct number of days, and that the frequency has to be controlled. But the way I look at it is ivermectin for the body. Ivermectin cannot cross the blood-brain barrier. Fluvoxamine does a similar thing as ivermectin, not exactly the same mechanism of action, but a similar thing as ivermectin, but for the brain tissue. So fluvoxamine is also important in addition to these steroids to make sure that a person who is in acute phase of the disease does not become a long hauler. And then aspirin, as again, I would explain the rationale a little later, but with doctor's advice. Now, management. So again, if a patient has become long hauler and has just become long hauler, then the same management as the acute disease. Give pulses of steroids. Couple of pulses I have seen work very well. One pulse works very well. And then if the person has become long hauler and is out of the acute phase, then ivermectin once again, and I'll go to the rationale for that. Steroid pulses are very, very important. Whatever I've seen so many doctors conjectures and hypotheses and attempts at trying to figure it out, from all the way from people saying this is just psychosomatic, which I think is cruel and ignorant of a doctor to just pick up something like this and say this is just psychosomatic. You're just thinking it. So from saying it is psychosomatic to saying it is not related to COVID, it is something else, to saying that this may be something with the immune system or the virus itself and so on, all of them eventually have to try steroids. Then CCR5 blockers, which may include Leronlimab or Maraviroc. Fluvoxamine. Fluvoxamine has been so beneficial in the long haulers that are outside of the initial acute phase and are still stuck with this disease. Their brain fog symptoms have been really helped by two things which I'm seeing. Actually, three. Ivermectin for the body. The massages, remember I had done a discussion about the brain fog and massages, myalgias and fatigue. So those massages, neck massage and the pumping of the cervical neck and the lumbar neck, spinal cords. So those massages and pumping of the cervical systems or the spinal systems allow the lymphatic and glymphatic system to work correctly. So that is very important. Plus fluvoxamine in the latest studies and from the patients that I have been asking, fluvoxamine has been really good. And finally, once again, aspirin. These are the current collection of medicines that I'm seeing are helping. Now, these medicines do not help where there is organ damage. For example, if somebody is a long hauler because they ended up in a hospital, they were on ventilation and the lungs have become damaged, then these drugs are not exactly what would help them. Of course, some of them are here that can help, but they are not exactly rehabilitating drugs. So now the patient has to go through the physiotherapy and rehabilitation, and they would take some time to recover as much as they can recover. Similarly, if somebody has a cardiac tissue damage or renal tissue damage or liver damage because of the disease or the drugs or the blood pressure changes, then that would have to be taken care of separately. I am specifically talking about those issues that are occurring because of immune dysregulation or viral persistence. So with this, let me just very quickly see here, how is everyone doing? So now let's look at the rationale. Why do we use these drugs? So after this, so today we'll talk about the medicines and their rationale, and then from tomorrow on we'll start digging deeper into what are the mechanistic problems that are going on. So I wanted to make sure that we have some way of looking at these things before we look deeper. So where is my toolbar? My toolbar has disappeared. Give me 1 second. Oh, well. So I cannot see my toolbar here. So I'm just going to work with the marker that I have. Brush panel is probably what I need. Okay, it is gone. So please bear with me. First, viral persistence. Imagine if the virus, for example, Dr. Bruce Patterson had said that in his research, he found that monocytes continue to have low levels of the viral presence. And if that is the case, and the virus would continue to bother the immune system would continue to try to attack it, and then that low level of inflammation would continue. So if the viral persistence is present and the low level immune response is present, then the two drugs that we discussed, ivermectin and steroids, would help. Ivermectin would help eliminate the virus or reduce the viral replication as much as possible, and the immune system, for example, steroids or CCR5 blockers, will help check the immune system. So that is one reason for the drugs that I discussed above. Then, and it is possible that the persistence is occurring in other cells as well. It could be occurring in the immune privileged sites as well. But eventually, ivermectin would help. Now, if the virus is sitting in the brain tissue, then ivermectin will not help there. And we'll have to figure out something like fluvoxamine or what other drugs can help there later on. Second possibility, viral hit and run. So the virus has arrived in our body, it has caused its own infection, our immune system has responded, then the virus has caused some mutation in some of the cells, and then it ran away. That is one possibility, causing immune dysregulation. Or it could be that it suppressed the immune system. For example, we know that CD8 T cells become less in the beginning of this infection. And when the immune system is suppressed, that would allow the other opportunistic viruses to pop up and start causing the infection again, which were just sitting in the body and hidden. For example, EBV virus. And then those viruses could create the side effects that we see in the long hauling. So if this is the case, once again, steroids are going to be the most important one to handle this situation. And the earlier that we can use them, the better it is. This is why using steroids near the last stages of this disease are important, and then using steroids later on are important as well. Then endothelial damage. It is possible, and again, I think that the chances of this being the phenomena are less. There may be some patients with this phenomena, and I'll explain why. But let's say endothelial damage. What that means is that we know that the virus can go and connect with the endothelium and then damage the endothelium and cause the hypercoagulable state. Imagine if the blood vessels are being damaged. That damage in turn may reduce the blood flow to various parts of our tissue, including brain and the muscles and other tissues, which would cause their activity to be reduced. And that reduced activity would create the symptoms that we see. If this is the situation, then once again, having something like anti-inflammatory system steroids and something like aspirin would help. So why I think this is less of a problem, although Harvard thinks that this is the main issue, I think this is less of a problem because if this was the issue, that the virus came in and caused the damage to the blood vessels and heart, which then in turn is causing less blood supply to the remaining body, then it would be equally distributed in men and women. And we are not seeing that. We are seeing predominantly women suffering more than men. And so if this was just the main reason, then it would be equally distributed. But if you look at it, if this is the reason, it is possible that women are affected more. If this is the reason, again, this is an immune cell, a monocyte, and it is possible that women are affected more. If this is the reason, then it is possible that virus is sitting in both men and women in some cells, but because women's immune system is stronger and reacts more, they are experiencing more severe symptoms. Then immune cell movement. So if we stand outside of the patients and don't look at the mechanisms, once again, we are seeing these symptoms that mean that there is either the virus is sitting there or immune system is dysregulated at the end, or both, or more things. At the end of the day, these symptoms are an indication of immune system's continuous function. To symptomatically treat it, meaning it's not a curative for the actual reason, but just to block those symptoms so that the person can actually start functioning again, the immune system's function can be suppressed selectively. And what is that selective suppression? CCR5 blockade. These are the receptors which, when get stimulated on an immune system, for example, memory T cells or T cells in general, then those cells will move to the area of infection and start attacking and fighting and cause inflammation and the damage there. They're trying to repair, but that would cause damage. So blocking some of the immune system behavior, if you don't want to give steroids to block a lot of its behavior, then CCR5, Miraviroc, or Leronlimab, or other such things may be useful. Then is the molecular mimicry. Molecular mimicry is that, let's say this is the virus, SARS-CoV-2. And this is possible with other chronic diseases as well, infective diseases as well, that some part of the virus protein to our immune system starts looking like our tissue protein. So a small 6 or 7 amino acid pattern on the virus resembles a pattern on our own tissue. So our immune system starts attacking our tissue thinking this is the virus. This is called molecular mimicry, and this happens with other viruses and bacteria as well. And that would then cause our immune system to just go in an autoimmune disorder and just continue to attack our own tissues, thinking these are viral tissues or viruses tissues. So that is also possible. And if that is possible, once again, if this becomes an autoimmune disorder, then steroids will have to be given, or selectively interleukin-6 blockers or other such drugs would be given. And then let's say the brain tissue. Now, for the brain tissue, there can be many, many reasons for the brain tissue to be involved. One is endothelial damage generally in the body, causing less blood flow to the brain and so less function by the brain. Second, as we saw with the olfactory system, that when the infection of the olfactory system occurs, that causes the glymphatic system not to function correctly and causes increased pressure in the brain, which can cause the symptoms that we look at with brain fog and memory issues and so on, psychological issues. Then inflammation in the brain. So let's say the virus actually ended up in the brain through the olfactory nerve, the nerve for smell, and then ended up in the brain and started causing the tissue damage, including myelin sheath damage. That is an MS-like situation. And then that would cause brain tissue issues as well, which will mean that a patient may have numbness, they may have tingly feeling, they may have burning sensation, they may have memory loss, they may have psychological disorders, they may have fatigue and malaise and so many other such things. So if it is glymphatics, for example, then doing the neck massages and the spinal cord pumps are very important. If it is demyelination, then steroids are very important. If it is inflammation, then although ivermectin will not help, but fluvoxamine would help. So these were the rationale for the drugs list that I have over here. So I will stop with this, and I'm going to keep it short video so people can actually watch it without becoming too hesitant. And we will continue with the discussions and go deeper in the mechanisms and then target further drugs for these. Tell me this, would you like to continue the discussion in chit chat, or would you like to meet tomorrow? Okay, so there is a yes to chit chat. So let's do this. I'm going to hang up here and then we'll meet again. So do me a favor. Do me a favor, please like, subscribe, and share. So that is something that is very useful. In addition to that, if you would like to support this work, there is a link in the description for becoming my patron. There is another link for buying me a coffee if you like, and then there is another link to support this work. So thank you very much, and I would see you shortly.